quarantine can really take a toll on your mental health. Dr. Drew here to discuss the science behind depression.
Yes, some of the clinical features. We're going to look at this image from Mayo Clinic. Reminder, the Chinese, one of the experiences that they had was a lot of depression from the quarantine. So let's be careful about depression. This is just a reminder that when depression, a major depressive episode hits, it is a biological event. That's a normal brain. This is a depressed brain with areas activated and areas were depressed. It is a different brain system. And if you are prone to depression, if you've ever had a depressive episode, this is the kind of thing that can really precipitate another episode. About 50% of people that have had depression will have another episode, so be careful. The symptoms I'm going to tell you about, starting with trouble concentrating, remembering details, making decisions. You can't make a decision. That's a sign of depression. As well as feelings of guilt, worthlessness. We don't think about those as depressive symptoms, but helplessness, pessimism, hopelessness. I don't know about you, but when I'm looking down the line a couple weeks, I'm not quite sure what I'm going to be doing. It makes me feel somewhat hopeless. I'm having a little bit of a depression right now. And by the way, again, it has to affect your functioning, it has to go more than a couple weeks, all these things. It can, it's not just that you have a bad day with some of these symptoms, it's that they stay with you. Here are some other symptoms. Irritability, people don't think about that. You just think your spouse is being difficult, but irritability and restlessness is part of depression. Anxiety can be. Loss of interest in things that were once pleasurable, including intimacy with your partner. Alex, we're back to Loveline again. Thank you for that.
Once a night, we're talking Loveline.
And of course, persistent, sad, anxious, or empty feelings. And of course, suicidal thoughts or self-destructive attempts. And again, this suicidality is a reminder that depression can be a fatal condition. It's an illness. It has a course, it has a treatment, and it has certain complications that can be fatal. So it's something to be taken very seriously. What I want you to do, what I'm going to do, because I started noticing I was getting a little depressed today, I'm going to get in the sun, I'm going to go running, the aerobic activity, I'm going to double down with my family, and I'm going to reach out to people that I care about, who care about me, and pay attention to my nutrition and sleeping and see if that doesn't do it. It probably will. If you have help, you need help, contact the LA County Department of Mental Health at 800-854-7771. Remember, this is a highly treatable condition, but sometimes you need a little help with it.
All right, so many people are struggling with that right now. Dr. Drew, thank you. We'll be right back.